Thank you for joining us today. Before we begin, we wanted to mention a couple of reminders. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause any issues. All attendee lines have been muted and the camera and chat feature is disabled. Please submit any questions for the presenters in the Q&A box. Additionally, if you have any technical difficulties during the webinar, you can also submit those through the Q&A box. This webinar is being recorded and will be available on demand. We want to welcome you to today's webinar titled Incorporating Radon into Comprehensive Cancer Control Plans and appreciate your interest in this topic. My name is Tiffany Belser. I'm the National Director with the American Lung Association and will be the moderator for this webinar. In addition to our presenters, I'm also joined by my colleague, Kevin Stewart, who is our National Director of Environmental Health. Kevin will be monitoring the Q&A box, so as I just mentioned, please type your questions at any time during the webinar and we'll address as many questions as we can later in the program. For any tech issues, our colleague Leslie Bilbay will be here to help with any of those as best that she can. The American Lung Association is the leading organization working to save lives by improving lung health and preventing lung disease, and we do that through education, advocacy, and research. Our strategic imperatives include defeating lung cancer, championing clean air for all, improving quality of life for those living with lung disease and their families, and creating a tobacco-free future. You can learn more about our initiatives around lung health and ways that you can get involved by visiting lung.org. We first want to take a moment to give a brief overview of what a cancer control program is for those that may not know. Since 1998, the Centers for Disease Control and Prevention's National Comprehensive Cancer Control Program provides funds, guidance, and technical assistance to help cancer control coalitions implement effective and sustainable plans to prevent and control cancer. The program brings together organizations that have an interest in keeping community members healthy in places throughout the country to create cancer control plans that help lower the number of people affected by cancer. State, local, and tribal areas come together to form cancer coalitions. Every coalition creates a plan to guide its activities by looking at common types of cancer and the things that can lead to cancer in the area. The coalition creates strategies that are incorporated in each cancer control plan to create a blueprint for action. All 50 states, along with the District of Columbia, 7 U.S. Pacific Island jurisdictions in Puerto Rico, and 7 tribes and tribal organizations have produced cancer control plans. However, only around 40 state plans incorporate radon in some way, whether through a small or in great detail. So the purpose of today's webinar is to encourage that all state cancer plans incorporate radon in an impactful way. This work stems from what we are doing through the National Radon Action Plan. The National Radon Action Plan serves as framework to guide nationwide action to eliminate preventable lung cancer from radon in the United States by expanding protections for all communities and buildings. The National Radon Action Plan is organized into 4 goal areas, which are listed on the screen. Each of the goals incorporates several strategies to achieve our outcomes. One of the strategies is to support state cancer control programs to include radon indicators and interventions. Our intended outcome is to have all state cancer control programs include radon risk reduction interventions in their primary prevention strategies for lung cancer. Today's webinar, we will provide information about radon, an example of a cancer control plan that incorporates radon in several ways, and a personal journey shared by a lung cancer survivor. We hope that this webinar will inspire those working on cancer control plans to ensure that radon risk reduction interventions are included in their efforts. And if a plan does already include radon, we encourage cancer coalitions to look over the radon components to see if there are ways to enhance those efforts even more. For today's webinar, we have 3 featured presenters. Our first presenter will be Bruce Sneed. Bruce was Director of Engineering Extension from 2011 to 2023 and is now retired after 45 years of service at Kansas State University. Bruce has a wealth of knowledge and will be providing an overview of radon in just a moment. Our second presenter is Lisa Morris. Lisa is a public health consultant with the Ohio Lead Poisoning Prevention Program and Indoor Radon Program at Ohio Department of Health. Lisa will be sharing an example of the Ohio Cancer Control Plan. And then our third presenter is Rachel Malberg. Rachel is a patient advocate who is here today to share how lung cancer has impacted her life. Rachel's journey reminds us how important this work really is. So many thanks to all of our speakers for being here today. At this time, I'm now going to turn it over to Bruce.
Great. Thank you, Tiffany. I'm really pleased to be with you today. I understand we have a large number of folks signed up, and that's great. And honored to share this next section of the presentation with you about radon basics. So radon, this unique naturally occurring radioactive gas, one of the fundamental atomic elements. You can see some important documents here, the National Radon Action Plan, the Guide for Healthcare Providers, and then the US EPA Radon Zone Map. So I'm going to provide an overview, look forward to any questions that you may have, and I'll try and keep things moving right along. So radon, a unique, naturally occurring source of radiation. It's a gas that's invisible, odorless, tasteless, colorless. It's inert, which means in its basic form, it doesn't interact with other atoms or molecules. But the kicker is that it's radioactive and it undergoes radioactive decay, emitting energy and particles from its nucleus. Radon is generated by the natural source of uranium turning into radium, turning into radon. And so the uranium and radium in the soil produces this gas, which can be trapped in the soil or find its way out of the soil into the atmosphere or into homes, schools, and other buildings. The half-life of radon is 3.8 days. And because of that relatively long half-life, when it's created, it has the opportunity to move from the soil into the atmosphere or into our buildings. Now, I recognize a guy from Kansas State University may be the most credible person you've ever heard, but the reality is all of these national associations and agencies say radon is a serious national health problem. And so you can rely on this expertise to be sure that what we're talking about here is a serious national concern. The reality is, with lung cancer, every roughly 22 minutes, radon-induced lung cancer claims another life in our country. And about every 17 or 18 minutes, someone begins their battle with radon-induced lung cancer. So it's a significant source of cancer mortality. The estimates that have been developed by the Beer Committee, by EPA and others reviewing assessments have developed an estimate of 21,000 lung cancer deaths per year, according to EPA's assessment of risks. This makes it one of the top 10 causes of cancer mortality in the United States. The mechanism of lung cancer induction is shown here. We breathe in radon, and most of the radon we breathe in goes back out. But when it undergoes decay and produces decay products, we can breathe those in. They can lodge in our respiratory system and in our lungs. And when they undergo radioactive decay, they emit alpha particles, which are like little atomic bullets. Two forms of polonium are created, which can emit these alpha particles, which in the very sensitive organ of the lung can cause physical or chemical damage to the DNA, leading to potential cell death, cell repair, or cell mutation, which can lead to lung cancer. So that's the mechanism of lung cancer creation associated with radon. The unit of measurement of radon is in picocuries per liter of air. 1 picocurie is equal to the decay of about 2 radioactive atoms per minute. The US EPA national guideline is 4 picocuries per liter. That's what we'd like the radon level. We'd like the radon levels to be as low as achievable in every home, but 4 is the guideline. And that's about 8 or 9 atoms decaying every minute in every liter of air inside a house, which could be millions of decays in the air. So the EPA and Surgeon General recommendations are to take action if a home is at or above 4 picocuries per liter. The US average indoor level is about 1.3 to 1.4 picocuries per liter in living areas. The outdoor level, there is radon in outdoor air, is about 0.4 picocuries per liter. But our goal is to reduce radiation as much as possible. So there's no safe level of radon. 4 picocuries per liter is the recommended action level. And the good news is almost all radon problems in homes and buildings can be easily fixed. Levels can be reduced to between 2 to 4 picocuries per liter, and in many homes, even below 1. And there are standards for mitigation that have demonstrated success. Testing for radon occurs most often in real estate transactions because it's a defect associated with the property, and it is a negotiable item. It would be nice if we could predict radon levels based on location of the house or structure, the type of building materials it has, the heating system, the foundation type, how old it is, how tight it is, what style of house it is, presence of other sumps, cracks, or other features. But there is no way to predict radon levels. We have to test to find out. That's why the Surgeon General has recommended that all homes be tested. The indoor radon level we find in any particular building depends on the source strength in the soil underneath the foundation of the structure, the porosity and permeability of the soil, how easy it is for the gas to move through the soil subject to building to soil pressure differences. These are air pressure differences driven by a variety of factors. How tight or leaky the building is, how well ventilated it is, and then the pathways through the foundation connecting the air in the home or the building to the soil. These variables create unique radon levels in every structure, and that's why all have to be tested to know. So this is a 1 minute and 15-second video that I'm going to show just briefly that makes these alpha particle emissions coming from radon and its decay products visible. So let me advance to the next slide. And this is the best video I've seen that makes radon more perceivable and understandable. So that depicts, and what you are seeing are alpha particle emissions, those little atomic bullets I mentioned, at a level of 100 picocuries per liter. The reality is, there's my home in Manhattan, Kansas, and this is a consumer product, right? If you had a consumer product that had an unknown level of a class A known human carcinogen, I think it'd be wise to test and find out about that. And that's why testing before buying is essential to avoiding or minimizing our exposure. At home is where we're likely to get our greatest level of radon exposure. Here is just a plethora of different radon measurement or testing devices: charcoal canisters and pouches. Alpha track detectors are long-term measurement devices. There are professional continuous radon monitors, and there are also numerous consumer digital radon monitors. And these are all viable ways to conduct tests in your own home, either using them yourself or if you hire a certified or licensed radon professional to test your home in a real estate transaction, which is, of course, always recommended. The good news is if elevated levels are found, radon can be mitigated. Typically, most homes can be fixed in a day with a simple system costing anywhere from $1,000 to $3,000 as a range, depending on type of building it is and a variety of factors, but you can see graphics depicting the most common radon mitigation systems here. An indoor fan system where the fan is in the attic, extracts radon from beneath the foundation and dumps it into the air above the house, or an outdoor fan system, the diagram on the right. And there's usually a pressure indicator inside the home on the pipe showing that the fan is creating the suction, continuous suction necessary to draw the radon from beneath the home and vent it into the air above the home. And this is shown to be a very effective approach to reducing. The systems work. Here's a graph showing the red line representing the EPA action level. The brown dots represent the fluctuation of radon before mitigation. And you can see the average in this home was 7.9 picocuries per liter. The green dots across the bottom show the average radon concentration over a period of time of 0.9, and that's after mitigation. So the good news is we have systems that will reduce radon in homes. The American Association of Radon Scientists and Technologists is the industry association, and they are an approved ANSI standards generating or consensus standards generating organization. So when you're looking for references about how to test a variety of building types, how to measure water, how to build new homes and buildings radon resistant, how to mitigate, and the different devices, look for these standards, and you can see the website here. But these are great references for the industry and for the public regarding the most appropriate ways to test, fix, and reduce the risk associated with radon. I know this is a busy slide, but it lays out for you the policy areas that can be addressed in cancer control plans. On the upper left, home buyers protections in radon and real estate. These are policies that require notification and disclosure of information. You can see many states have disclosure requirements. A number of states have schools and child care facility testing requirements. States, probably in the neighborhood of 20 or so, have credentials or private certification requirements. And then radon resistant construction, codes, standards for homes and buildings are all areas that can be addressed with cancer control plans in terms of the goals that you develop for cancer control plans. Here's a slide that shows the category in a number of cancer plans. The percentage of the number of plans, this is a review done a number of years ago that incorporate these categories, and then some quotes on the right-hand side from plans in that category. What are we trying to do? Well, identify homes with high radon levels through testing, support EPA's effort to require testing in homes and buildings, ensure that there are policies in place for government to take action about radon. So there are many cancer control plans. You can see the numbers there that have these kinds of activities and goals incorporated into it, improving testing, building radon resistance, and so on. So it's all about testing, fixing, and saving a life. That's what the radon mission is: testing homes, mitigating high homes, and reducing lung cancer risk. This is a resource for you. At Kansas State University since 2009, we have provided national technical assistance for EPA. And so sosradon.org is available with all kinds of great resources and examples to draw from. And here are resources for you, my email and National Radon Program Services phone number. And I'll turn it back to Tiffany right now.
Awesome. Thank you so much, Bruce. Always am very impressed with your radon knowledge. So thank you so much for all of that great detail. Just a reminder to everyone to please type your questions for the presenters in the Q&A box, and we'll address those at the end of the program. Just a reminder too, all of your lines are muted if you're an attendee. So if you raise your hand, we're not able to call on you. So please put those questions in the Q&A box and we'll address those. So now we're going to turn it over to Lisa, who is going to share Ohio's comprehensive control plan. And I just want to mention, we know that there's many states that incorporate radon into their cancer control plans, and this is just an example of one of them. Go ahead, Lisa.
Thanks, Tiffany. Yes, so Lisa Morris, I work at the Ohio Department of Health in the indoor radon program. I specifically work on the outreach and education side of our program. We are fortunate enough to also have a licensing and compliance program as well, which I'll mention quite a few times throughout my presentation, mainly because I think that gives us an advantage in terms of having a cancer control plan that has radon in it. Having a licensing program allows us to have access to a bunch of data that some states who maybe don't license for radon in their state don't have access to. So our Ohio Comprehensive Cancer Control Plan is ran by the Ohio Partners of Comprehensive Cancer, so OPCC. Radon exists under the early detection, the primary prevention branch of it. So there's three branches in our cancer control plan. We have primary prevention, early detection, and quality of care. And radon exists in the first one, so under primary prevention. And we're in the environmental carcinogens work group, but radon is the only topic that exists in that work group. So I do co-lead this work group with some of my colleagues and some of our local partners. This is the first time since radon's been in the Camp Comprehensive Cancer Control Plan that it is a 10-year plan. So previously our plans have been 5 years, and we used our previous 5-year plan to set our baseline data for our 10-year plan. So we have one objective, and then we have a series of strategies to reach that objective, which I will talk about. So our main goal here is to increase the number of mitigation systems that are being installed in Ohio homes. So we want to have 100,000 new systems over the next 10 years, increasing it to 167,000 mitigation systems. Like I mentioned, because we do have a licensing program and we have a phenomenal licensing program, they do a lot of great work with desk audits, and inspecting mitigation systems and making sure that we're getting the reports in a timely manner. We do know how many systems, for the most part, are being installed in Ohio homes, where they're being installed as well. So we have access to data. So that kind of helps drive these strategies. So our first strategy that we have is to increase public awareness to the connection between radon and cancer risk. And one main way that we do that here in Ohio is during January, we do launch a National Radon Action Month media campaign. The budget for that is increasing slowly over the years. So we're able to do not only like radio PSAs, but social media advertising, and a few other ways where we promote our radon test kit program, our free radon test kit program, the resources that we have at the state in terms of connecting the public with a licensed mitigation specialist or a radon tester, as well as where they can find additional information on the ODH website or the US EPA website. So we do that every January. We do attend various events across the state. Specifically, we will go to home and garden shows and talk to people who may be purchasing a home and wanting to test. Like Bruce mentioned, a lot of the testing does happen during real estate transactions. So we will encounter people who are looking to purchase a home or recently purchased a home and maybe have never heard about radon, or we're just unaware that the state does offer free test kits. We go to school nurses conferences where we will talk to school nurses about the importance of testing. So we do a lot of events throughout the year to kind of raise public awareness for the first strategy. The other strategies that we work on that are probably the most popular, or the ones that we can tackle pretty easily, are the encouraging home buyers and sellers to hire a licensed radon professional. And I'm going to skip ahead just a slide and come back so that you can see what I'm talking about. So we do have some resources on the ODH website where people can connect with a licensed radon professional in their area. So this is just a screenshot of the ODH website. There's a link that says hire a professional. They go there, and then this is what they'll see when they do click on the hire professional link. So this is newly revamped in the recent years, and there's some new features of it, specifically allowing the public to export a list of contractors or testers in their area, which is when we receive calls at the state level, a lot of people are asking for this resource. So now we can export a list and send it directly to them if they're unable to access internet and look it up themselves. So as you can see on the list, on the page, at the top over on the top left side, they can search by tester or a contractor. Um, they can also search by county or zip code. And then they have license number, name, address, all the contact information they would need to contact somebody in their area. Um, and like I said, they can export this list and this is updated in real time. So if somebody's license was to expire today, if they were to access this list tomorrow, that person would be have fallen off this list. So it is a great feature to have, and we do advertise this not only during National Radon Action Month, but anytime we're at events. We also make this aware that people can access this and get in contact with somebody who's licensed. Um, some other strategies that are in our cancer control plan that are going to help us reach our goal of 100,000 new mitigation systems is educating realtors. So the state of Ohio is a licensing state, like I've mentioned. So I am licensed as a radon tester in the state of Ohio. I don't do any testing, but it's so that I can talk to the public about the importance of testing and answer any questions they may have about radon testing. And with that, we do have a 2-hour CE class available to real estate professionals free of cost. So I do many of these across the state throughout the year. So essentially, a real estate board would inquire about me coming to their board or their meeting, and I would teach a 2-hour CE class on radon testing. I would provide them with our radon booklet so they can pass out to any of their clients, help answer any questions that they may be receiving from home buyers and sellers. And it is a 2-hour CE, so they do get 2 CEs towards their license. It is a very popular class. And the people are usually really engaging. You can tell that they get a lot of questions around radon during a real estate transaction. And so we do hold that course as well. For medical professionals, typically um, we can do a 1-hour CME if we have like a lunch and learn with medical professionals that's approved, and I will go and speak to them during like a 1-hour lunch and learn session about radon and lung cancer. The fourth one here, supporting legislation for building codes. This one is probably one of the strategies that we don't tackle the most, and when we definitely have room for improvement here. I will say that Ohio currently has about 7 or 8 jurisdictions that have adopted Appendix F into their building code. And so any new homes being built in those areas are being built with radon resistant new construction. Um, we obviously provide the information about Appendix F and getting it adopted into different building codes, but we don't have a great way of tracking that at the moment. So that is something that we are working on, and we definitely have room for improvement on, obviously. And then our fourth strategy, or our final strategy, I should say, is reducing the out-of-pocket costs associated with radon testing and mitigation. Now, like I mentioned, we have a free radon test kit program, so that is pretty easy for us to achieve. So we purchase test kits from a vendor. Our current vendor is AirCheck. And what you see on your screen is if the residents go to that ohio.radon.com website, they'll see a simple pop-up like you see on the left-hand side. And it says free radon test kits available to Ohio homeowners. They just click that link. They'll put in their name, address, an optional email if they want tracking information. And it's pretty simple. And those test kits come straight from the vendor to the Ohio resident. So we don't keep any of those test kits in stock at ODH. We don't deal with any of the shipping or the lab analysis. That is all handled by our third-party vendor. But we do also get the reports from all of those test kits. So what I mentioned earlier, we have an abundance of data that has allowed us to really be successful in this comprehensive cancer control plan and meeting our strategies is because we can see how many tests are being done by homeowners, and then we can see how many tests are being done by licensees, and we can see how many mitigation systems are being installed. So we have a good grasp on what's happening in Ohio in terms of radon testing and mitigation, which has made it pretty easy for us in achieving some of the work that we're doing. Um, the associated costs with radon mitigation is something that unfortunately we have not been able to assist with. All of our funding is from US EPA and the state indoor radon grants, and there's restrictions on paying for mitigation systems with those dollars. So we have not been able to assist with mitigation costs at the moment. There's lots of conversations being held about how we can do that or what programs are available to do that. Occasionally, we will refer a lot of the inquiries we get to local health departments because they have some type of like weatherization grants or separate grants that can assist in the mitigation costs. Because while we know testing is like your first line of defense, the cost associated with the mitigation system is sometimes too much for a lot of people. So we are working to see what we can do in Ohio to assist with that. I think I've skipped around quite a few times, but oh, sorry. So those are the resources that we have here in Ohio. This is the Comprehensive Cancer Plan Basics. It's a pretty simple plan that we have. Radon was in the cancer plan before I started here at ODH. So in terms of getting radon into an already existing cancer control plan, I would not have a good idea on how it was incorporated, but I would say that the OPC partners are very excited to have some type of environmental carcinogen in the cancer control plan, as radon is the only topic area that exists in the control plan currently. So we are on track, I guess I should say, to meet our goal currently. I haven't ran the numbers recently. We typically report on an annual basis, but we are on track to reach our goal of 167,000 new mitigation systems. That's about 10,000 systems a year, and we are currently surpassing that. So we do fully intend to meet that goal. And I will pass it back to Tiffany.
Awesome. Thank you so much, Lisa, for all of that great information. You all are doing some amazing work in Ohio. So thank you. And I'm just going to advance the slides here. And so now we're going to hear from our next presenter, our last presenter. Rachel is going to share her journey with us. And just a reminder for everyone to please place any questions that you have for the presenters in the Q&A box. And as soon as Rachel is done presenting, then we will go ahead and address those questions. All right, take it away, Rachel.
Thanks, Tiffany. Good afternoon, everybody. Thanks for joining today. Hopefully I can wrap us up with an interesting end to your day. So with that, I am Rachel Malmberg, and I am a 6.5-year stage 4 lung cancer patient, and I'm going to walk you through my journey a little bit and then share a little bit about my story. And sorry in advance for some coughing or muting. I do have COVID, so bear with me as we get through the day. So my goal today is to take you guys through my personal background, my diagnosis, my treatment, and then really talk to you about how you can make a difference and continue doing the work you're doing in a meaningful way, because we all know that it's often unthanked. So with that, I'm a former collegiate and Olympic athlete, so I played hockey for a living. I'm a mom, a professional, and most importantly, I'm an advocate, and I have been a huge advocate of radon testing, mitigation, and awareness since the moment that I found out I had lung cancer, and I didn't even know that radon existed until then. So with that, I'll walk you through my diagnosis. So in 2017, I was diagnosed with stage 4 adenocarcinoma. And upon initial diagnosis, I had spots in my brain, my chest, and my right lung. So the picture that you see on the screen here is the first time that I saw my tumor. So that's a chest CT, just for those of you who are non-medical. And for me, it was kind of one of those shocking moments. Having being a former Olympic athlete, I was a very highly trained person with really good endurance, and I always ate healthy, so it was kind of a shock. And in that moment, you kind of start looking like, why? What could cause this? Why me? You have a lot of questions. And so I instantly jumped into learning, and that's how I've kind of got through my whole process here. So one of the things I like to do is, I know we're talking about radon today, but I also like to educate just a little bit, because every person that you run into, you have an opportunity to change their life as well. So with that, I was very lucky that my doctor ordered testing for me. And so I have the EGFR mutation, but if my doctor would have not ordered that testing, I would not be here today, because traditional treatment of chemo would not be a good fit for me. It's almost like food for my cancer. So I'm very blessed, and I hope that if you guys get questions or have the opportunity, just mention to patients or anybody that there is lung cancer comprehensive testing, and it's more than just having CT scans and things like that. There is diagnostic testing that should be done for mutations. So with that, to date, I've had brain radiation and spine radiation a few different times, and I have been on 2 different drugs. So my first line of therapy, I was on for 5 years, which is pretty amazing because most people don't get that long. So I'm very blessed in that way. And I recently started last year my second line of therapy called Tagrisso. And I had kind of an adverse reaction to the higher dose. So I'm now on a lower dose. And then I had my right lung and lymph nodes in my chest removed back on the original diagnosis. And I was one of the first, actually the first patient at Mayo Clinic as a stage 4 lung cancer patient to get their lung removed. And I think this has really treaded and built the way for other patients. And for me personally, I believe this is a reason that I have long-term survival. That one. With that, I want to talk pretty heavily a little bit about like the reality and the journey, because this is where you all come in. So hearing the C word is already stressful, and it can have immediate effects on people. And our ability to overcome that instant fear that you hear when you hear the word cancer is critical. And we all play a role in that. So some of the things that a lot of cancer patients deal with is managing competing priorities. So the one thing that you hear is your health is most important. But in order to have that health, you need to work or have some sort of funds coming in so you can afford your drug. You can afford all the other drugs to counteract the side effects. You can deal with, the healthy eating and all these other things. But there is this competing priority of, how do I work or maintain what I need in order to provide and buy my meds? And that's where you heard our previous presenters talk about the cost of radon mitigation, and how can we put in programs that help patients and families get systems that can save lives in a more cost-effective way. So the other thing is waiting. We know that testing is critical, whether it be for cancer or any other type of testing, but especially in radon. But that wait can be really hard. So I would encourage you in the industry, one of the things that I would say is helping people understand that getting a system in today versus 1 week from today, yes, it's extremely important, but it's not going to be life or death in that moment, and that it's okay to take a breath and allow the testing to occur the right way instead of trying to force it and rush it. So what I've learned in the last 6 years, in educating and talking to a lot of people, is there's this sense of urgency that it has to happen overnight. And I think we have the ability here to educate people on the importance of doing things right and getting the right system in and knowing the right information so that we have a good go forward approach. The other thing I would say is information overload. So super easy to want to give everybody, like Bruce has 45 plus years in the industry, and I wish I could engulf all of that knowledge, but I can't. And so figuring out what are those key few things that you can give to people that they can ingest and pass along. So the biggest thing that I've learned in my journey as a patient is patients talk to patients. So that one quick snippet that you give me, I'm going to give to somebody else, and probably 15, 20, 30, maybe even hundreds of other people. which then turns into a populace of communication and education. So if you can come up with 3 quick things that could make a big impact that you would want passed on in the communities that you serve, you're going to get rapid transference, and that's extremely important for us to continue raising awareness and making change. The other thing I would say is the lack of information. So as an industry, you guys are all incredibly smart. You're all subject matter experts in your own way, but you're talking to people like myself who is in a state of fear and trauma. And sometimes we don't know the information, and it's hard for you to take that moment to take a deep breath and say, oh, let me help you. Let me educate you. So if you can just take a deep breath and just assume that people are leading with love and give them as much information as you can in a moment, but leave things behind so that people have a moment to digest, that will go a long way as well. And then credibility of information. So I think this is one of the biggest things that I'd really hope you guys take away today is that we don't want people talking differently about other systems or each other, or, if a system was put in wrong, or there's a problem, or the fan's not big enough, etc. Instead of adding more fear to an already fearful situation, educate them on something positive. Turn that potential loss or problem into a positive solution. And don't challenge what happened in the past, but tell people what you're going to do going forward. And that will help build the industry's reputation and really change this struggle that sometimes we can have about trying to do the right thing all the time and not getting a lot of traction. And then the last thing I would say is loneliness. Just remember, wherever you sit, whoever you interact with, and however you interact with people, is you don't know what that person's walking through. And so that person, you as a person, a stranger, a new voice, if you will, may be subject to data dumping. Somebody who's going through a traumatic time and just learned about radon or just learned about cancer or something like that may suddenly want to share their story with you because you're a stranger, you're a safe person. So be willing to listen and validate and say thank you for sharing. But just know that a lot of people that you interact with just may need to have you listen. So with that, what is your role? So I hope I can leave you impacted today because my life has been dramatically impacted by this industry. So I have seen some familiar names pop up. So thank you for hearing my story again, for those of you that have already heard it. But this industry has been incredibly special to me because when I got diagnosed and I learned that radon was a factor of lung cancer, I tested my childhood home and it tested at 69 picocuries, and I had lived there for 18 years. So you can imagine that that was a hard pill to swallow. And then I also tested my personal home that I had lived in for 7 years, and it tested high at 7.9 picocuries. So when you piece all that together, for 26 plus years of my life, I had been living in a radon exposed area, even though I was a high athlete and other things. So for me, this industry, learning, being a part of it, being accepted, being supported, and being loved has really allowed me to be a successful survivor. And I have put systems in 4 of my last 4 houses. So I'm a huge supporter of this. I've done a ton of advocacy work. So I'm hoping that today I can help impact what your role truly is out of the experience that I've had. So with that, I think the big things that I've learned is we need a better understanding. What is the need of radon testing? What is the need of mitigation? Those of us who understand it and are here obviously know that. But how do we change that story? Lisa did a really nice job of kind of outlining what you're doing in Ohio, and I'm quite amazed and really blessed to hear that that's what's happening. But how do we duplicate that and spread that across all the other states? When Bruce shared his slide on the states that have the different requirements or mandates or new houses that have to have systems put in, how do we take those and duplicate it across the country and keep it safe for everybody? I think that's the understanding that we have to continue to build and fight for. Awareness and collaboration is a major key. So you guys can't do this alone. You are in the fight every day making difference. You need people like myself and others to really start speaking out and get a rally going. So if you're interested in that, let me know. We can put something together. But I think continuing to build awareness and try not to get exhausted, even though the work you're doing is amazing, keep going. You're educating and potentially extending a life. So Bruce touched on this, but the work you're doing, it's not just work. It's truly saving lives, whether it be my kids who are living in my home or another baby who's born or a person who already has lung cancer. You're allowing us to live a better life because of the work you do. So don't forget that you truly are extending life. And when those days get hard and you get exhausted, don't forget that you are doing things that are saving lives and it's important. There is a person behind everything you do. So having been in the industry of healthcare and running a call center, I know that we can take our frustration out on people sometimes. And at the end of the day, we just need to remember that there's a human behind everything, and we don't mean to take it out on you and our fear base. So just remember there's always a human on the other side of that. And then the other thing I would say is control what you can control. If there's anything I've learned in my 6.5 years, it's I am not in control of this world. And that I have to allow others to help, and I have to control the things I can and admit the things I cannot. And that has been one of the biggest lessons and the biggest blessings that I've been given. So, in a moment of struggle, just take a deep breath and remember you can only control what is in your control. With that, the flip side is taking ownership. Don't just pass the buck. So, one of the hardest things as a consumer or as a patient is when you are in need, you don't understand, you don't have the resources, or you just are expecting that educated person or that SME to know what to do. And then they say, well, I can't help you with that. Take ownership. Tell us what you can do versus what you can't do. I think that goes a huge long way, and especially for reputations. I have been working with patients and families. Even last week, I needed to engage the industry to try and get a fan in for a lung cancer patient who just can't afford it. And her entire family has come together to try and come up with money to do this. And what they kept being told is, we can't do it. You either come up with the money or we can't do it. That's not a functional way to do it. So help us learn. What can you do? I can give you a fan. I can give you this. Here's a resource. You can get a free testing at the Ohio website, right? Those are things you can do. So take that ownership and give us guidance. Drive the future by building trust and understanding. So that ties into kind of what I just said of the more that you're transparent and supportive, the more trust you're building and the more understanding you're building, which then transfers to that next person and the next person. And now we've got a big wave and a big line of transference going on in education, and we can get a wave of change going. And lastly, I just want to leave you with the fact that you independently have the power, knowledge, and ability to make a difference. But when we do it all together, we have the ability to make an even bigger impact. So I just want you to remember, no matter where you are today, no matter what's going on in your life, that you truly have the ability to make a change and make a difference. And at the end of the day, we're all here together trying to save lives and make change. So with that, I just wanted to give you guys a quick summary of a bunch of the advocacy work that I've done in the past. So if you want to Google my name, that's an easy way to go about it too. But with that, thank you so much for all the work you do. Thank you for listening. And I'm going to turn it back over to Tiffany.
Thank you so much, Rachel. I have not heard your story before live, so you're such an inspiration, and thank you so much for sharing your journey with us and being such an amazing advocate. Really appreciate it.
Thank you.
All right. At this time, we're gonna, if there's any questions in the Q&A box. Kevin, are you seeing anything over there?
Yes, we are. And I did want to, there was one administrative thing. There was a question about whether we can get a copy of the slides. I know that if people want some specific requests with respect to that, people should contact Tiffany directly. I know that there might be some things that can be shared, some things not. And I just want to make sure that people have the opportunity to get what they need while respecting the needs for others to maintain control of their materials. So on that point, I did want to move on to some questions. And since this is a focused program, about incorporating radon into comprehensive cancer control plans. I'm going to start by emphasizing those questions and first directing some things to Lisa that came in. One of them was, are there any supports or resources available for renters?
So, great question. We do allow renters to request the free test kits, so they can, there's nothing against a renter testing the property in the state of Ohio. So they can test the property. Now, if they find an elevated level, lobbying with their landlord to fix the problem is sometimes an issue, but you do have that option. We have like the Ohio Healthy Homes Network here in Ohio, who does a lot of great advocacy work for renters in regards to radon. Um, so that's about all we have available, but we do make the same amount of resources that we have available to homeowners. They are available to renters as well.
Thank you. Thank you. And another one was, do Ohio public schools have any regulation or guidance with respect to radon?
Another great question. So prior to 2009, yes, we did have, and I forget the name of the law at this moment, but it was repealed in '09. So there was a request requiring schools to be tested on a certain frequency. I don't know that it was annually, but there was a frequency that they had to test. It was repealed. So there is no requirement today. And again, that's something that we're focusing on. What we found here in Ohio is when most schools don't want to know, unfortunately, because if they test and they find the issue, it's a costly it's very costly to mitigate an entire building. So when we're advocating for them to test, they'll say, well, what's my requirement if I find an elevated level? And unfortunately, if you find it, you don't have to fix it. But what kind of picture does that paint for parents that you're aware that this is there and harming the kids there, but you don't want to you don't want to fix it because it's too costly. So we have found some pushback from some boards from testing. We continue to try. We do have some local health department staff that go into school board meetings and will talk with parents and the school board about testing and how they can train their staff to even do the testing so they don't have to hire somebody, so they can do like the janitorial staff can go in and do the testing to save some costs. Um, but yeah, unfortunately, it hasn't been a great buy-in from schools. That's not to say there aren't schools here in Ohio that do it. We do have some schools that are very proactive and are great to work with, but currently, no, there's no state standard or requirement in Ohio.
Right. Let me just follow up, and I know I want to get to Bruce because I know Bruce has something to say on this topic as well. One question I guess is, part of the understanding about what a comprehensive cancer control plan is to what extent does it have any teeth? In other words, is it something like is a guidance for policymakers, but it's optional, or how can people, for instance, understand a cancer control plan maybe to set forward something like all schools should be tested for radon and following proper standards and so on. And as part of the plan, so that then people can point to it and says, well, it's in the plan as something that we should do. And I guess I'm just curious whether, even as guidance, not even if there's no requirement by state law.
Yeah, so in Ohio, what's in our cancer control plan are typically things that we could achieve. So I
Mhm,
would say that it's not something that we would put in there,
mhm.
to have teeth or to derive something. It's more optional. We typically put things in there that we know we can achieve or that we're already achieving. So yeah,
Okay.
if we were to add that as a strategy, as a requirement, we would need to have like a law or something in place prior to putting it in there.
Oh, sure, of course. Bruce, could
Kevin,
you address a little bit on this? Because I know that there was some concern raised by sometimes schools about the costs and so on,
sure.
and
Let
maybe you have some experience on all this subject.
I just want to add something to the question about renters, if I could.
Mhm,
In the states of Colorado and Illinois, laws have recently been passed
mhm.
that provide options for renters to deal with testing their own the facilities and dealing with landlords. So I just want to point that out. If you're looking for current legislation, Colorado and Illinois have examples of that.
Yeah,
Yeah,
very good.
the challenge with schools is difficult because um, of budgets, and if you're going to budget for radon testing, are you going to budget for mitigation if when elevated levels are found? Fortunately, it's less likely in schools and large buildings compared to residential structures, but yeah, it's something you just have to incorporate into the budget process if you're going to address it. We want to be sure that when they do testing, they get it done right the first time, so that they do a complete footprint test, or if they can, of a school or of all their schools, there's just lots of options. And the best thing to do is work with the state radon control programs that are in virtually every state for guidance and information about resources available. For example, here in Kansas, we can help schools with testing programs and review like a quality assurance plan for conducting tests, and help them. So I encourage all folks to contact state radon control programs to see. Some states like Missouri, the goal has been to test all schools. So different states have taken different approaches, and some states have legislation that requires testing in schools.
Very good. And I would like to add another point on there. In Pennsylvania, there's some legislation that's being worked on. It's nowhere near finalized, but the idea of trying to sort of help spread out the idea of the costs rather than a school being afraid of needing to put major systems in all their buildings, which is a relatively unlikely scenario. The idea of it being a statewide plan of apportionment of funding to help schools get tested and to do the mitigation work that might be necessary up front is another model that can be used and can help relieve people's fears about costs that they might have to bear if it is statewide as an approach.
Another state with a good example of school testing initiative is Iowa.
Very good. Excellent. Let me keep going here. I know that I'll start with a hard question here, and Bruce, this may have been something that the call center has dealt with. Does lung cancer that is believed to be due to radon exposure correlate with any specific types of lung cancer or biomarkers? What do you have on that?
Not really. It's mostly small cell. Rachel probably can speak to this more effectively than I can. But it is, it can, certainly can cause all kinds of cancers, but the small cell seems to be the more likely one. But Rachel should weigh in on this one.
Oh, please, Rachel, please.
Thanks, Bruce. Okay, so full disclosure, I used to work in the cancer testing industry, you guys. So I'm recently 3 months retired from the industry. So I'm going to give you some of that knowledge as an independent person. So those of you who know me from the industry, I'm no longer with that company. So there is a lot of trials right now and research going on trying to identify specific mutations within lung cancer that are tied to radon. I know one specifically in Canada. One institution up there is doing a lot of work on this and trying to correlate it. So we expect in the industry within 2 to 3 years, hopefully, that there will be able to be some better specific diagnosis. So just on a personal note, so I have what's called the EGFR mutation, and I'm super special in that I have 3 different ones within that. So I have exon 19, exon 21, and T79M mutation. So those of you who are interested, you can Google it, but there is some research going on to identify potentially exon 19 and 21 may be tied to radon. So there are some studies going on, which is really exciting in my opinion, obviously as a patient, but also being in the industry. One of the things I would say is, to Bruce's point, we often hear about small cell, but that also often gets correlated with smoking. So just keep that in mind. I'm a non-small cell, never have smoked, never experienced smoke in my life kind of person. So push the boundaries and ask those critical questions. But whoever wrote that question, I absolutely adore you and thank you for asking that, because we're going to break that barrier soon.
Very good. And thank you very much. I know that we're about out of time. Very quickly, granite countertops came up. What happened to that issue? What's happening there?
It is highly unlikely. It's not impossible, but it's highly improbable that a granite countertop is going to contribute significant amounts of radon to the indoor air radon levels we find in a home. You're more worried about the radon coming out of the soil underneath the building than coming out of what may be granite or other radium-bearing materials in the home. There are ways to assess that qualitatively with some testing processes, but our general recommendation is if you're worried about granite, don't use it. There are many other countertop materials, but it's highly improbable that it will be contributing significant amounts.
Tiffany, can I squeeze one more question in?
Sure. And thank you for anybody that's hanging on with us.
And the other question, a professional in real estate with lots of experience, Florida and North Carolina, said we found lots of elevated radon in homes with slab and basement, but somehow not finding radon in homes built on crawl space. Just wondering about studies of radon across foundation types and what could possibly be the story there. I don't know.
It doesn't really matter what kind of foundation you have. You can have elevated levels of radon. It's been found in basements, slab on grade, crawl space, all weather wood foundations. I can't give you percentages because there haven't been studies to that end, but the reality is radon is everywhere. The only way to know is to test, and whatever foundation you have, you could still have high levels of radon.
Thank you. That's all I think that we had time for, and thanks very much everyone for your questions.
Thank you so much, everyone, for your great questions. If you did ask a question and we didn't get to it, we'll make sure to respond to you individually. And thank you so much to all of our presenters for being here and joining us for this webinar, and all of you. Just before we go, we just want to mention that we do have a brief survey that we hope that everyone will participate in. It helps us plan future educational opportunities. There's opportunity to also suggest topics around radon that you're interested in and resources that you're looking for. You can see it you can access it through the QR code on the screen, but I'll also be sending around the evaluation link, the webinar recording, and resources mentioned during this webinar. We also encourage you to go to lung.org/radon, where you can find lots of radon resources, including our Radon Basics program, the National Radon Action Plan, and lots of other resources for professionals, including information about radon testing in schools and other great things. So thank you, everybody, for being here today, and we hope that you continue to talk about radon. So thanks, have a great day, and take care.